Hello, everyone, and welcome to today's webinar, Restoring Heart in Healthcare, How Recognition Combats Burnout and Builds Employee Resilience. My name is Bronson Dameron. I'm the Director of Content here at Awardco, and I'm here to give you a little bit of logistical information and to monitor the chat behind the scenes. So you'll see me here for a minute. I'll introduce our speakers, and then I'll pop back off. Just for some logistical things here, please chat into the chat on your right. Let us know where you're watching from so we can kind of get to know each other. And ask questions. I will be monitoring that backstage, and we will have a Q&A at the end of this webinar so that our speakers, Christy and Laura, can answer your questions and kind of go over all the things that they chatted about there. In addition, if you'd like to learn more about Awardco throughout the webinar or after, you can click that button in the top right of your screen that says Learn More About Awardco. And finally, we will be having some SHRM credits available at the end of this session. We will be providing a code, and you'll be able to get that for your SHRM credits. Now I'd like to introduce our speakers, Christy and Laura. As they come on stage, I'll introduce them a little bit more. Christy is a member of our Center of Excellence here at Awardco, and she specializes in corporate integration. She's an employee experience expert with lots of experience in companies like Cisco and others. And we also have Laura Dalfrez with us. I'm sorry if I butchered your last name there, Laura. Laura is the Senior Director of Benefits and Employee Health at Franciscan Missionaries of Our Lady Health System. We're excited to have you both here, and please take it away, and we'll have a great webinar.
Thank you so much, Bronson. So great to be here. Nice to see some friends from all over the country, Cleveland, Phoenix, Great Falls. So welcome. I'm Christy Gilhoy, as Bronson said, and I'm here with Laura Dalfrez to talk about putting the heart back in healthcare. I come from the high-tech world and have done a lot with Awardco and with recognition programs, but I think that healthcare is a very special area, and we have an expert in that field. So really excited to welcome Laura to the stage. How are you, Laura?
I am doing great, Christy. Thank you so much for just the opportunity to come have a chat with you and just share some of our journey with Awardco.
Excellent. Well, I think I'll set the stage. One thing I found interesting, we've been doing a lot of research here at Awardco about where different industries are in terms of their journey with recognition. And I come from the high-tech space. I know folks in IT have really gotten on board with recognition. But when I look at where the people are who take care of our children and take care of our loved ones and take care of our family members or ourselves when we're in trouble and need health care or education, recognition has a little bit to catch up. So I'm really excited to find out from Laura sort of what's best in class with what she's been doing with FMOL Health. So I will go to my first question for you. So talk to me, Laura, about the specific challenges in healthcare that you see right now.
Oh, this is a good one. So if I had to maybe narrow this down, because obviously we do see are faced with a lot of challenges today. I would probably pick workforce shortages, burnout of our staff, and rising cost, just to name a few.
And so when those things are happening, what made you think that you needed a recognition strategy? How did you come upon that as a lever to really help in the healthcare space?
Yeah, so I'll just maybe I'll take a moment just to kind of talk about those three things and how they sort of led us to our journey with creating a formal recognition program. So obviously in healthcare, we are the caregivers. The majority of our workforce is clinical in nature, so taking care of the communities that we serve. And so there's just time constraints, right? So recognition isn't a priority because you're faced with other urgent clinical demands that you have to take care of. Staffing shortages, coming out of the COVID era, burnout because of just the nature of healthcare and the stress that comes along with that. Our team members are faced with emotional fatigue. So it's really hard to muster up the energy to recognize when you're just emotionally depleted. You're faced with not only challenging situations with the patients that we're caring for, but maybe even in your personal life. So, having that balance there. And so we recognized that we needed a formal program that was easy for both our team members and our leaders, and helped us to address some of these challenges that we knew that we were going to be faced with, including making sure that we had, a great structure for the program, education, and communication to go along with that.
Well, hats off to you, Laura, when you're dealing with a fast-paced environment, lots of staffing challenges, burnout, to be able to pull yourself above the waterline and think about putting a program in place for your employees, that's very laudable. Obviously, a program comes with some kind of a budget outlay. And so how did you think about that? So how did you structure that so that have, none of us have unlimited budgets. So how did you take the funding that you had, or maybe you took it from other places, to develop a program that would have the biggest impact on your employee base?
Yeah, no, that's a great question. So budgeting was probably the biggest challenge in all of this. We have certain programs that we have in place today that have very fixed budgets. So our service anniversary, our holiday, our Christmas gift, our birthday, those are pretty easy to handle and manage from a budget perspective. But when we introduced our manager to peer and our peer-to-peer program in 2024, obviously it required a little bit more effort on our part to make sure that we set it up right. I don't know that I mentioned this in the beginning, but here at FMOL Health, we truly believe our team members are the hearts and hands of our ministry. And so we knew we had to set this up right to be successful, to be meaningful, and to be impactful for our team members. So we approached the budget a few different ways. We considered, from a manager to peer perspective, designating X number of points per leader. We also considered X number of points for each direct report, or do we just go with one overall leader budget that they all kind of tap into throughout the program year in order to make those monetary rewards? Ultimately, we landed on X number of points per direct report. We felt like this aligned with our overall ministry. It was a just way to approach this, especially as we were venturing into this space for the first time. So essentially, the points move with the direct reports, meaning if the direct reports have a change in leadership, we reallocate remaining points for those direct reports to the new leader. And if there's no leader, we're allocating up to that next available leader. So we did face challenges, to your point. We still do today that we're working through with regards to our budget, just around certain groups who don't have access to the platform, or maybe they're not eligible for benefits or that monetary recognition under the program. And then we have our executive leadership who may not have a lot of direct reports, but they wanted the ability to be able to recognize and show appreciation for those indirect reports.
Yeah, that population piece is tricky, right? And I know sometimes we get caught up in the idea of recognizing people and giving them points or money, but the behavior of recognition is just so important. So if you have different populations, contractors, PRN folks, they can still be part of the program. They just might not be eligible for points. So talk about that piece. You have different populations in healthcare. How did you build a program that fits all of the different teams, contractors? Maybe there are FTE teams that are led by contractors, all of those different mixes.
Yeah, so if I'm being completely just transparent and honest, we did not have a lot of this knowledge up front. So some of these things we learned very shortly after we launched our program. So I'll spend some time talking about our PRN population, first of all, because obviously they're important to the success of our organization. And the way our HRIS system is built and seniority dates are built in our system, we have an original hire date, and then as you maybe leave and return to our organization, you get a most recent hire date. And then our monetary recognition awards and our benefits are driven by a different seniority date. So we had to be very intentional with our integrations and what we were passing to Awardco and what dates we were using when we built our program to ensure that our PRN population felt, while they weren't getting the monetary recognition, that they were receiving that personal recognition, and that their dates were accurate. So I'll give you an example. Like we faced a PRN employee who's been with us for about 10 years. And because of how we originally passed our dates, they received a recognition thanking them for their first year of service, or maybe it was their second year of service. So you can imagine kind of how deflated they felt when they've been here for 10 years and they were getting recognition for 2 years of service. So we, again, had to go back to the drawing board, look at our integration, and be able to adjust some of those dates so that they were appropriately recognized for the service that they had given our organization. We also had a fairly large number of contract leaders and contract team members. We also refer to them as contingent. And so our contract workers, whether they be a leader or a team member, they're not eligible for any benefits or for the monetary recognition, nor do they have access to our Awardco platform today. Another future state that we'll talk about later, but they don't have access to the platform. So we had to figure out a way for our contract leaders who are overseeing active employees who do have access to the platform. How do they recognize them? How do those active team members receive the benefit of this recognition program, especially on the monetary side? And then for our active leaders who do have access to Awardco, but their team members may be contract and don't have access, how do they still engage in this program effectively? So we created what we call praise cards, worked with our marketing team, created a little 3x5, I think, card that has our praise logo on the front and on the back. There's an opportunity for our contract leaders or active leaders to write a personal note of recognition and then check off which of our core behaviors that align with our mission were exemplified by that team member. And then it's a physical card that they can hand to the team member. And it's so cute just to see our team members. They really light up when they can take these little cards and post them either in the break room, or maybe they put them in their workspace or their workstation. They really get excited about the physical piece. So that was a way that we addressed that population. We still wanted them to be recognized, and we wanted the leaders to have a way to recognize them. And then we are currently working for our contract leaders who don't have access to the system but have active team members. We're working on a process right now to use the AwardCodes, which is the physical card that they can actually give the active team member, and they can go claim their reward in the system. So yeah, we had to do a lot of thinking outside the box for those groups.
I love that, Laura. Thank you for being transparent, because nothing starts as you mean to go on sometimes, and you have to make adjustments, but that's the purpose of these webinars. There are specific challenges in healthcare. There are specific challenges in tech. And so showcasing people's journeys and sharing best-in-class practices just will shorten the time for the future Laura's and Christy's, right, to set up their programs.
Absolutely.
And I also really like that you're using different modes. It's great to have an online platform, but you need to have the muscle of recognition and catch people doing something good with a card, with a note, with something that you say. So I love that it's a comprehensive program. I think that's great.
Yeah, thank you.
So standing up these programs, you can't do it by yourself, right? You need a lot of stakeholders, and especially when you're presenting a budget or when you're trying to get leadership buy-in. So talk about how you found those stakeholders. Did you have an executive sponsor? Like, how did you set it up to move this through to get approval and to get it launched?
Yeah, no, I really like this question, and you said it perfectly. It takes a village, and boy, did we realize this whenever we were launching this program. We actually engaged and collaborated with several internal teams. We did have our VP of Total Rewards, which was our executive sponsor, and having that person in place was very beneficial, because as many of you on the call probably know, when you launch any type of initiative in a health system, you have to have buy-in and approval and engagement from the top down. And so me, in the role that I'm in, I don't always have the audience of that C-suite or that executive leadership team. So having that senior executive on our total rewards team who has the audience of that group to really explain our why, to explain the rationale, and really to allow our data to speak for itself, because our team members have told us very loud and clear that recognition was important to them. And here's how they want to be recognized. And so getting that information in front of our leadership, aligning it with the strategic initiatives that suite is working on already, really helped to move the needle in this space for us. So very appreciative to have that executive sponsor. Another key stakeholder in this was our Marcom and our communications team, and they still are today. Like, we can't continue the movement, the motivation, and encouragement for our team members and our leaders to bring the awareness of the importance of recognition without that team. They were able, along with my team, were able to build a very robust communication plan that not only showcased the implementation of our praise program, but what did we need to do ongoing? Like, what did that cadence look like? What was the frequency of those ongoing communications? And how were we going to meet our team members where they needed to be met? And so we go to those modalities. So we leverage multiple channels to educate, encourage, and remind our team members of how to recognize and the importance of recognition. And our organization is really big on the why, and we feel like we can get buy-in much easier if our team members understand the why behind what we're doing or what we're trying to get them to do. So a lot of effort was spent in that space. We use our intranet. We have an internal communication platform called Team Talk, and our team members are highly engaged in this. There's an app that they can download. They can access it from their phone, and I think we're in the 90% registration with that particular platform. So a lot of activity, a lot of movement in that platform. We used emails. We held a lot of education webinars, live webinars, recorded webinars, and we still do that today. We made videos because, again, we knew we had to meet team members where they needed to be met. So we tried to get very creative with our modalities. We had a lot of internal communication. I spoke about our praise cards. We created program guides and FAQs that are updated even today, separate for team members and leaders, because obviously there's very specific requirements and just education we needed to do with our leaders. In addition, because we're a faith-based organization, we wanted to be able to tie all of this effort, all this great recognition that we're planning for and doing back to our organization's mission. So we have 4 core behaviors called Be the Love, Be the Guide, Be the Catalyst, and Be the Bridge. And so when a recognizer is giving praise, they have to tag at least one of those core values, just to show how that team member exemplified our organization's mission and values.
I love that. And it also takes those values off the shelf, right? You can have them in your employee handbook, or you can have them in your orientation, but to bring them to life, to catch people actually doing those behaviors in the organization and to show other people what those behaviors look like in action, that's really culture building, right? Because culture is built by what we do, not always what we say or what we do when no one's looking. And so catching people doing the things that really underscore that faith-based FMO health and the behaviors you want is amazing. I can't say enough about having a good internal communications team and plan, not just for the communications planning, but for the change management. If you're going to roll out a new program and people are a little bit nervous about trying something, or they need best practices, if I'm a new manager or a new leader coming into FMO Health, how do I find out how to use the program, or what's the enablement for me as a brand new leader?
Yeah. So I am very proud to say that our organization recently secured a partnership with Gallup. And some of you on the call may be familiar with Gallup, but we are from our president down 100% invested in our leadership and leadership development. And obviously a part of that Gallup platform is recognition. It's the power of recognition, how to effectively recognize. And so we've built so many triggers in the journey of a leader in our organization, from onboard, ongoing, that really provides them the tools and resources that they need, including orientation. They have scheduled sessions with our learning and leading team, one-on-one sessions and group sessions. And in those sessions, they're going over this. So our recognition program is included in that so that they know where to go, how to access it. Through Awardco, we also deliver a onboarding email to new team members to let them know how to register. And then we have a host of other resources available on our intranet and our Total Reward site for our leaders. We also do check-ins with our new leaders because they are, as a new team member in general, you're faced with so much information overload. And so we don't expect them to remember all of it. So we'll do, check-ins throughout their at least 1 year, just to make sure that, they have what they need, they have the support they need, they know where to go for the resources, and little nudges here or there just about the recognition program and, how to access it, how to engage their team members, and just address any questions that they have.
And what has the feedback been from managers who use the program, who are in there? What have you heard back from them?
Man, they love the program. They are so excited just about the opportunity to, recognize sometimes leaders, and we saw this early on, leaders that we would talk to, forums that we held to get feedback. They just felt like they were very limited in the ways in which they could recognize. And sometimes it felt very fake. It didn't feel genuine. They felt like they were just, kind of walking through the motions with regards to recognition. And now with our partnership with Awardco and the program that we've put in place and how we tie it back to our mission, it is really creating a culture of appreciation. We've seen that shift. It's real. In meetings that I go to, in leadership meetings, everybody's talking about this cultural shift, and we feel it in our organization because from, again, the top down, we're talking about it, the awareness of recognition and showing the value. And, something as simple as just saying, hey, Christy, I noticed what you did, is just so powerful. And I think, we had the naysayers, as any group does, that really didn't believe how powerful this was going to be. But it has. We have definitely seen a great movement, and there's still excitement today. So we're a year in to launching this program. And I get hit by emails, and sometimes people are just like, I'm just so grateful that we have an organization that, supports and recognizes, our team members and gives us different ways and avenues to do that.
I love that. When you're Laura or a Christy and you're trying to set up this program and you're getting ready to turn that switch on and you're like, oh my gosh, is this going to work? It can feel really vulnerable and really like, okay, all eyes are on me, and I have this VP of Total Rewards who's my sponsor. This better work. And so just to be a year in and see it working and see have this feedback is great. A couple comments. We've seen in our research, Laura, that sometimes we get asked from people, well, is there too much recognition? Can you give too much recognition? And both in our research, but just in our, power in the proven of being in different organizations, no one's ever said, like, I've had it up to here with, recognition. I'm just over it. You can do things that are not as genuine or that are not as meaningful, but if you help train, which it sounds like you're doing, your folks, like, I see what you did, here's why it's important, here's how it connects to our values, and here's why it makes our patients feel so cared for and loved, and it drives our mission, right? Just connecting that, and it plays out in the ROI. I mean, it plays out if it's manager to peer. It plays out in terms of getting the right people and getting them to stay. And then back to your comment in the beginning, if peers are also recognizing peers, that can really influence burnout, right? And well-being, and just like, okay, other people have my back. I'm part of a team. I'm tired. I'm just one of many. So, there's inevitably, after the feelings, there's like, people will ask about ROI. So maybe you can talk about what's some of the data that you've seen. Talk about your surveys, perhaps, like the trends that you've seen from launching a program now that you're a year in.
Yeah, absolutely. So, one of the things that we've been very intentional about here at FMO Health is tying in recognition to our overall employee engagement. And I mentioned we have a newly secured partnership with Gallup. And so our we did a survey in May. We're about to do another survey in October. And we use the Gallup 12, which is just 12 very specific, intentional questions that we ask our team members. One of those questions is, in the last 7 days, have I received recognition for my good work, for the good work I've done? And that question, we've learned over the past year, can be interpreted many different ways. So we've had very specific education and webinars on kind of breaking down the employee engagement survey. Our leaders were tasked with creating action plans, but not the leader creating the action plan, but allowing their teams to create the action plan to move the needle. So we are early in the engagement survey results with Gallup, but I have no doubt that when we do this survey in October, and even our spring survey in 2026, those will be most telling to the impact that this praise program has had since we launched it in 2024. So I'm very excited to see the outcome of those surveys. So if we connect again later, I have no doubt I'll be able to share some really great stories. We have seen just overall engagement with the surveys go up since we've launched. So we were maybe in the 70s range initially when we were surveying our team members with regards to just participating, just feeling motivated enough to participate in the engagement survey. We're now in the upper 80s, which is phenomenal. We were all celebrating that with our last. And we've seen a steady increase in recognition in both our manager to peer and our peer to peer programs. So when we're looking at this on a monthly basis and a quarterly basis, and I don't know, Christy, if you have the slides that you can share, but we have seen that just steady increase. In some areas, it's, 100, 300% up. I think for us, we attribute that continued steady increase in recognition just to the communication plan, because there is no way possible for a team member and leader to not be aware or to forget about this program. Like, we are keeping it in front of them using all modalities. It's funny because as the leader of our benefit programs, obviously I get a lot of email traffic, and I'll have individuals, or I'll even see emails where I'm not, directly copied, or I'm directly copied on it, but I'm not the intended audience for the email. And they're sharing praise or appreciation in these emails. And so I'll just give them a little nudge, like, don't forget about our Awardco platform, the praise platform, just to remind people, because we get busy. We have a lot to do. We're caring for our loved ones and the loved ones of our friends and neighbors in our community. So we get it. We realize they get busy, but we're not going to let them forget. So we keep putting it in front of them. Making sure that they are engaged and that our team members are engaged. And we often, like I said, hear from our leaders that they can visibly see the shift. And it was a big investment. It was a big investment that came from top down. And I mentioned this, our executive leadership is 100% invested in both our leaders and our team members. And so I think the ROI, while the data is minimal at this point, you can see on the screen just the great things that are happening in our organization through this formal structured program, the excellent communication plan, and just the buy-in and the investment from our leadership.
I love that. I think also, Awardco is it looks like a social media platform, right? And, I'm Gen X, so I'm still on Facebook and just dipping my toes in Instagram, and my daughter's on all the new ones. But there's mixed feelings about social media platforms out in the universe because you see both positive and negative things there. But a recognition program functions differently, right? It's basically all good. And so I know you had a story about sort of how you talk about that in your organization. Yeah.
Yeah, so I can't help but smile, Christy, when we talk about this because it's just warming. It's very warming to see what's happening in our organization. And I tell leaders, if they come to me and they're having a difficult day, or they, maybe we open up a meeting and we're just kind of chit-chatting before people come into the meeting, because a lot of our meetings are virtual these days, but we'll just be talking. And so they may mention a rough day or a challenging week. And I often tell people, look, I have the medicine for your challenge, for your bad day.
I love medicine. That's good for your field. That's good.
I want you to go to our Awardco. Do you know how to access that feed? I'll remind them. You need to go to that praise feed, because I promise you, after you read all of the accolades and the appreciation and the personal notes from our team members to each other, you are going to see a boost in your mood. I promise you. And we tell our leaders, even our team members, but specifically our leaders, lead with gratitude. And when you see all of that gratitude happening on that feed, you can't help but to smile and just to feel good about the work that you're doing. Because sometimes we don't feel appreciated, unfortunately, sometimes because of, various things that may be happening in that situation. But I tell people, go to that feed because you will definitely reap the benefits, and you will feel the positivity. You will even feel validation for the contributions you're making in our organization. So I get goosebumps every time I talk about it. It's so good. And what's funny is I hear other leaders talking about it too. Like, did you see the post on the feed about blah, blah, blah? Because we're a big organization. We have remote workers in states, but we're primarily in Louisiana and Mississippi. So we're not able to connect with everybody in our organization all the time. So it's another great way just to see not just what's happening in our own space, but what's happening everywhere else in our organization too. I also have
those unsung heroes, right? If you're in a different location, you don't know what people are doing. So it's putting that sunlight on those unsung heroes, which I think is so valuable.
Yeah, and it creates unity, because we are spread out. We're a big health system. We have hospitals, we have clinics, we have outpatient centers. And so it just creates that unity, not only within our own team, but just as an organization as a whole, just to feel good and to be proud of all the great work and contributions that are happening in our organization.
It's a good part of going viral, right? On the
absolutely.
Organization. I love that.
Absolutely. It's definitely been positive for us to get acquainted with and experience with the virtual world, for sure. We just had a presentation happening the other day, and they experienced a technical difficulty in the middle of the presentation, which, man, you never want that to happen. But the leader that was kind of overseeing or championing that project, she reached out to our IS team, and they quickly intervened to resolve the issue. And while she was at a pause and speaking during the presentation, she quickly went on the platform and sent a praise to that IS person. And so I don't know if I mentioned this earlier, but when we deployed Gallup, we have educated our team, our leaders, on the GET approach, which is recognition that is genuine, individualized, and timely. And
Nice.
boy, did that, that one example really exemplify that. And our IS team was actually the one sharing it, and they were so appreciative that it was real time, and they were just amazed, like, man, she's still in the presentation, and she's already given the recognition. So it's really nice. It's nice to see the smiles, and just to see the validation that our team members feel from, receiving the recognition.
I love that. I think there are specific teams that just benefit right away with the off-glow of all this recognition. Like you said, your information services or your IT. I know audit and finance, sometimes those folks don't get a lot of love. I know sometimes the people who put on events don't get a lot of love. People who work night shifts, people don't know what they're doing on night shifts. So there's so many places and corners where people are making a difference, and this program can help call it out. The other thing I think is it helps good managers be even better, and it helps people who are new managers or learning to be better managers get better. I think when you talk about go on the feed and just look and it'll feel good, good managers always tell their employees to have a praise file, to keep the good things about them. Well, this is like an automatic praise file. Another thing really good managers do is like figure out individually what really motivates their employees, right? Does Laura, does she like flowers? Is she a coffee or a tea person? Does she have kids or not? Like, how can I make sure that if I do something for Laura, it's meaningful? And you had a nice story about that, about one of your managers who does that.
Yeah, I did. We were actually having a fairly large leadership meeting, and we were talking about recognition because, as I mentioned, it's on the agenda of pretty much every meeting throughout our organization, always. And what's funny is people don't get tired of it, right? They're like, oh, we're talking about recognition again. They want it. They love it. They feed off of it, so which is great. But we had this leader who part of his leadership goal was to develop a tool that he could share with those leaders in his portfolio that he worked with, and they could share with their team members, and kind of an about me profile. And so I'm sitting back listening to him in the meeting, just kind of grinning. And so once he finished talking, I was like, Dustin, guess what? I have something for you. So what we're very excited about is the move of our platform to Awardco 2.0, which we will be doing in early 2026. And if any of y'all are on that platform or will be moving, they have the new About Me profile, which asks all of those relevant questions so that you can make sure you are giving your direct report or whoever you're recognizing meaningful recognition that's important to them. And so I shared this with him, and he was like, man, I created this whole project and this tool and all these questions. I wish I would have talked to you beforehand. So it was just a neat just example to see. And I've been kind of teasing it in some of my other leadership meetings, and leaders are super excited about it. Like, I wish I could make a book of all the pages that these leaders have created over time, just to kind of keep track with this. And I hear them say over and over again, man, I don't know where I put that, or I filed it away in my computer. And we're almost organized to a fault. I can't find it in my folders in my computer. So I'm like, now you don't have to worry about it, because it's going to be right there in the platform, and you just go directly to it. And what's really nice about it is that you're not just going to be able to see that of your team. So if I want to recognize housekeeping, or if I want to recognize somebody in another department, I can see their profile, and be able to make it more meaningful.
And as we all become more public, right? Some people, I'm married to an introvert. He doesn't want all that stuff everywhere. So sometimes the profile can let you know, hey, Bob doesn't like to be recognized in big groups. Bob likes private recognition or one-on-one, or maybe Sarah wants a skip level meeting with a VP. Like, that would be meaningful recognition. Or, maybe Dave wants to do some professional development and learn or do a rotation. So I think back to your initial part, of course, it's lovely to have a budget and get points, but for some people, that recognition could take on different forms. And for leaders to know how to motivate their employees is really, really important. So what's next, Laura? What's next for, you've been at your year end. What are you going to do next?
Oh goodness, do we have another hour we can talk about this? No, I'm just kidding. So we have been very intentional up to this point, and not just with this program, but just our organization in general. We usually like to roll out big initiatives in phases, and our praise program has been no different. Obviously, we were all excited and we wanted to just launch it all at one time, but we knew that we had to kind of scale back a little bit, knowing our organization, and we needed to make sure that we structured it so that we could have successful intervals with the program. So we're excited to move to Awardco 2.0. I think that platform is going to really, I like the layout of the platform. I think it's easy to use. I think our leaders and our team members alike will really enjoy the new platform. And it has some new functionality that we haven't tapped into everything yet, but we're certainly continuing to explore that. So thank you to Awardco for that platform. We're also continuing to enhance, we have a department incentive program. So when we originally launched our praise program and really partnered with Awardco, which happened a few years prior, we have been really bombarded with requests and asks for, hey, I typically do this for my department. Can we use Awardco points? Or like during open enrollment, we do incentives for early enrollment and those types of things. Can we use Awardco points? So I can't tell you how many times I've been asked, can we use Awardco points? So I worked with our account team at Awardco and our leadership team, and we launched a few years ago department incentives. So when departments want to do that, it's evolved, right? So it was, kind of handshake in the hallway conversation. And we've gotten a little more formalized about it now because there's such a demand for it. Like our team members love to get Awardco points. And so we leverage it anytime that we can leverage it. So department incentives, instead of doing, or maybe in addition to the pizza party or the ice cream social, they might have a drawing for Awardco points. And some of our team members are hoarders. So they have in the thousands balance because they're waiting for the big ticket item, which is great. It's why I love the Awardco platform, because again, it meets team members where they want to be met. They can spend it as they get it, or they can, save it up. So we're excited about enhancing that program, maybe tapping into we've been talking with our account team about tapping into the nomination and the earn program, which we haven't done to date. So I'm really excited about getting that off the ground. And then probably most importantly is leveraging the external recognition, because we're a healthcare organization, and our patients, not our team members, our patients that we serve, many of them love to be able to provide feedback and recognize the great caregiving that they received while in our facilities. And so the external recognition will be something that we'll launch in 2026 to be able to allow our patients to do that, and for it to be seen again by our entire organization, and maybe not just between that leader and that team member, or maybe announced, as a kudo in the department, but seen system-wide in our organization. So we're really excited about that. And then just tapping into the Awardco bulk email reminder. So we're doing a lot of that through our internal channels that I mentioned, but we know Awardco can send out these bulk emails as well, just reminding our leaders that, hey, you still have a balance. Don't forget to recognize, here's why it's important, as well as to our team members. So we're excited about just enhancing that reminder capability. It's very exciting and it's overwhelming at the same time.
We're going to need a part 2, Laura, like in a year, just to see what's going on. I think in our pre-call, we talked about, and that we obviously watch the same movies, but this idea, if you build it, they will come. you know, when you're doing the change management and you think, "Ooh, are people going to adopt this?" Then you find out that people have a little program over here in Excel and a little program over here. And so just that administrative burden coming off of people is great when they can put it into Awardco. And then I love the patient external recognition. If you've just had a moment where you're in such a fragile time with yourself or with your family member, and you can literally scan a QR code and say, you know, this person just made my day or held my hand or gave me great care. Those are super impactful moments. So I love you're thinking about that external recognition. I think that's a huge lever that will just make it even more exciting at FML.
I agree.
Well, I think I'd love to get some questions from the group, but before we go to that, you know, we opened with this with saying restoring heart in healthcare, which I know is very close to your values. But how anything else you want to add on how having this recognition program has helped with the heart in healthcare?
Yeah, I really like this, Christy, and thank you. First of all, thank you for just inviting me to have this discussion with you today. You know, it's ever changing. I feel like it evolves daily, changed significantly since COVID, especially with care delivery. And I feel like as a healthcare organization, we have to pivot a lot. And we ask a lot of our workforce, you know, pivoting so frequently, you know, being faced with all the challenging situations, just illness in and of itself. And unfortunately, there's not a lot of, you know, positivity that comes out of it. You know, certainly hear the negativity, but the positivity. And so we realize, you know, I'll go back to what I said in the beginning. We recognize our team members as the hearts and hands of our ministry, and we want them to know with 100% certainty their value, and how we appreciate the contributions that they make on a daily basis, because their contributions bring our mission to life on a daily basis, and we want them to know it and feel it. I mean, I'd get goosebumps just talking about it. Our executive leadership, again, they are 100% invested in this effort. It is a collective effort, particularly around engagement and recognition, just to make sure, you know, that our team members do feel appreciated, they feel seen, in an impactful but meaningful way. Our organization has received over 50 accolades over the past year in all of our markets, which we're very proud of. So I would say, yeah, we're seeing the positive impact of our work. We're feeling it, you know, so those feelings come within, and we're feeling that change, not just in the communities we serve, but also within our organization. So our recognition journey continues to build a culture of appreciation, and to celebrate our team members in very meaningful ways. So I'm excited to see where we head in the future.
I love it. Well, it's been such a joy to get to know you on this prep journey. And I came to this work because I truly believe it's work for good. And it's beautiful work and it's just so important. But when it dovetails with healthcare and it really is life and death and it's your family and the people you love, it's just such important work. And so I'm so glad to hear your real life case study of this. And I hope that other folks, I know we've got some healthcare folks on the line who may be thinking about their journey. Maybe they have a recognition program, maybe they're earlier. So would love to take the next 10 minutes, check in with Bronson and see if there are questions and just continue the dialogue.
All right. Thank you so much, Christy and Laura, for that conversation. It's been really impactful as I've listened. I'm not in healthcare, obviously, but really appreciate both of your perspectives. So thank you so much. We do have some questions here that I'd like to pose to you both. As we get into that, I want to remind all of our viewers here that we will have a SHRM credit available for you as soon as we're done with the Q&A. We'll get to that for sure to make sure that you get that. But let's start in with some of these questions. Laura, you mentioned that recognition can help with burnout. This is a question here in the chat. You mentioned that this can help with burnout, and it's helped change the culture of your team. Could you elaborate on that a little bit more, specifically how it's changed the culture of your team, what it was like before to what it's like after?
Yeah, so I mean, obviously, we have workforce shortages, and a lot of those shortages are due to the burnout, and we could see it. We could see it in our engagement surveys. We could see it honestly just walking through the hallways. Coming out of COVID and all that COVID brought. That emotional fatigue was absolutely. It was real in our organization. In our exit interviews, we could see the feedback that we were getting from those who were leaving our organization, leaving for work elsewhere, for even a different line of work. So we had people leave in healthcare. And then we had those who were choosing, hey, I'm retiring early, just because of that burnout. So it was visible in all of those ways. We saw it in the interactions. I could feel it when interacting with other team members or leaders. And now there is just a renewed energy. It's very hard to put in words. That is a great question. It's hard to put in words because you just feel this renewed energy in meetings. People are making it a point to be intentional with sharing the positive, and not just bringing up the negative. And they're finding ways to share gratitude even in those difficult situations. Like, what is something positive that can come out of this? We agree it's frustrating, it's a bad situation, but what is something positive? And it just puts a different spin on things. So it's a culture shift. I don't know how else to describe it, but it's so exciting. I've been with this organization. It'll be 28 years in January, and I'm actually a nurse by trade, and got into HR a little bit later in my career. And so I can appreciate both the clinical and the non-clinical side of it. And I have a renewed energy, having been here for 28 years, because every corner that I turn, there's just such exciting things happen. I mean, I have a leader, I have a couple leaders that report up to me. And I just shared one day, I said, hey, I'm just reaching out this morning just to say good morning. Hope you have a good week. And that leader responded, thank you so much. I mean, this really just made me smile that someone noticed, they took the time out of their day. And so that's not, anything great for me. I'm just saying we're seeing that throughout our organization, where people are just they're being intentional, and they're just taking a few seconds to say thank you, or I see you, or I notice. And so that renewed energy helps to combat that burnout, right? Because you have emotionally, you have energy that kind of overflows into your physical energy. And so I think, for us, we've definitely seen a decrease in that. And we have people wanting to stay with us. And we have, our onboard and our recruiting tools are just flooding with applicants, because people know, I mean, it's getting out into our communities, the impact and the change that's happening within our organization.
And Laura, just to add to that, healthcare is growing, and you've been there 28 years, but I know a lot of my daughter's friends are going into healthcare and are so excited and have so much energy to bring to the field. And for them to land in a culture that sees them and recognizes them and gives them good feedback, that's how you're going to keep that great talent.
Feedback and recognition the way they want to get it, right? Yes. Not just, through one means, how do you want to get it? And let's make that happen.
And that generation is used to getting consistent feedback, right? They're tech natives. They've grown up with that. They like that feedback. They like seeing what other people are doing. So I just think it's a win.
Great question.
Yeah, that's incredible. Thank you so much for that perspective from the both of you. Really appreciate that. We have time for one more question, and then we'll kind of wrap things up here. This is from Sarah. And what you kind of touched on this a little bit, Laura, and you mentioned throughout the webinar that your leadership is very bought into recognition. And this question is, Sarah says, my leaders often say recognition is nice to have, but we don't really need it in light of other things. How can I help them change their minds? She asks. What would you say to that?
Yeah, Sarah, that's a great question, and you're not alone. We also, and we still today, obviously we have the leaders that say that, we just actually ran a quarterly report to see how many of our leaders since July, because our budget's based on the fiscal year, how many since July have utilized their renewed or reallocated budget. And out of about 1,000 leaders, we have around 400 who haven't given any recognition. And so here comes all of our reminders and stuff. And so those are, Sarah, to your point, maybe the leaders that still aren't completely bought in, they don't really recognize the value in it. And so we just keep plugging away. We don't let them forget about it. We use our data to share, to really share our story. So we pull the data from our engagement surveys. We pull the data from our team members to put it in front of them to say, while you might not realize it, here is what our team members are saying. And I'm telling you, it's very hard to argue with data, very hard. So we leverage our data to be able to kind of change their spirit about recognition. There's always going to be ones that you're not going to. I mean, that's just, inevitable. But I think through our communication channels, through our leadership development, so we make this a part of your leadership goals. And we don't necessarily tell you how to do it. We give you the tools and we let you create that recognition structure for your team that works for you and your team. We know it's going to be different from department to department. So we give leaders autonomy to kind of structure it. And we tell them, talk to your team, ask the question and then just sit back and listen and hear what your team members have to say about recognition and what's important to them. And you can't deny what's factual, what you're hearing from your team members. And then we have a lot of champions throughout our organization that can help coach our leaders and help get them to the point where they need to be with regards to recognition. So I think it really all goes back to awareness, regular cadence, frequency of communication. Use your data to tell the story and the why. Why is it important? And then make resources available to that leader. Maybe they're just tired. Maybe they're feeling burnout. Maybe they're exhausted and they just need some little nudges to help them get creative with their team.
I love that. Thank you so much for that. I really appreciate that. I'm going to put up the SHRM credit here just for our attendees, so you can see that and get that credit. You should be able to see that on your screen now. This code is where you can enter in when you log into your profile on SHRM.com, and you can get an hour credit for your recertification. In addition, if you're interested in learning more about Awardco and you want to know how it works and how it can work for your organization, similar to how it's worked for Laura, please click the button on the top right and we'll be able to help you out with that. As we wrap up here, Christy, Laura, I want to give you some time for some final parting thoughts. Christy, if we could start with you and then Laura will end with you and then we'll wrap it up. But yeah, any final thoughts here?
Sure. I think my favorite thing about this is how Laura really married the heart and the head, right? She has the heart for this program, but she was very wise in instituting the engagement survey and really thinking about the data and measuring what's working to give that concrete information back to her leaders. So very excited about sort of phase 2 of your journey, and it's just been lovely to talk with you.
Yeah, thank you so much. I just appreciate the opportunity to share our story. And, I am very open to speaking with, any of you on the call today. We certainly don't have all the answers, and I could probably learn some things from those on the call too. I think if I would say one thing, it's just to give yourself grace. If you are launching a new program or an enhanced program, just to give yourself grace, be intentional, and make sure that you have a very robust communication program, because I really do believe that was critical to our success up to this point. So thank you. I've had a lovely time today.
Thank you both so much for your expertise and your kindness and for sharing all of this. We really appreciate it. And thank you all for joining us for today's webinar. You'll receive a recording of this in about an hour to maybe sometime tomorrow morning if it doesn't come right away. And we really appreciate you. And if you have any questions, please feel free to contact us or get in touch with Laura or Christy, and we'll be happy to help you. But thanks for attending, and we hope you have a great day.